Mark Rogers here, jumping on live. It is our entry-level House of Healthcare in retirement. So many changes are happening for retirees, and I'm always been wanting to say, let's share how to build this House of Healthcare. Make it effective, make it affordable, make it long-standing, because a lot of retirees now are not finding what they're looking for. They're being surprised. Some that have been in retirement for 10 years now have regrets. It's because we haven't effectively planned accordingly. So we got a live stream going to go happening here in November. Looking forward to working and sharing ideas along the way. I think it's very, very important to have ideas to share. And I've had 20 years of learning this, and I work with a lot of clients, and I thought I'd like to go live streaming every day here in November, sometime in the 10 o'clock hour, 10 o'clock every morning. And also you'll see scrolling across the bottom as well. I also have at 11 o'clock here coming up every day as well, a private Zoom. What that means is that you can jump in privately and ask your questions as well. So that'll be in roughly 1 hour from now. That's when you can ask questions. So what's going on in healthcare and retirement with Medicare and all that? Well, the interesting thing is there is a lot of turmoil in the Medicare Advantage realm of things. And what that means is that locally here, there are Medicare Advantage plans that are pulling out of the county, and it's not just here, it's other places as well. And there are specific things that you can do during that time to make it better for your retirement. And so I wanted to make sure that you have some tools to work with. Take some notes along the way as well. One of the things I wanted to do along the way too is talk about news. The news is bringing out interesting stuff about healthcare, and I wanted to quickly bring up this article straight out of the Wall Street Journal, and it's very interesting. What they're saying here is the sickest patients are fleeing private Medicare plans, costing taxpayers billions. And so it goes on. This is Wall Street Journal from November 11th. It would have been yesterday, 9 o'clock on the East Coast, that private Patricia Green had spent a month recovering from devastating stroke when her Medicare Advantage insurer, a United Healthcare group, decided to stop paying for her nursing home. Oh my goodness. 85-year-old was weak and fragile, her son said, but she couldn't even get herself out of bed. Her family felt it wasn't ready to leave the facility in New York's Queensboro, so she dropped her United Healthcare coverage and enrolled in the traditional version of Medicare run directly by the federal government. The decision saved United Healthcare thousands of dollars in the months that followed, billing records show, and shifted onto taxpayers the cost of later hospital nursing care, what turned out to be the final months of her life. Interesting about Wall Street Journal analysis of Medicare data found a pattern of Medicare Advantage sickest patients dropping their privately run coverage just as their health care needs soared. So I wanted to kind of bring that into perspective here. There are reasons why this is happening along the way, and it's there's a lot of turmoil that's going on, and I want to at least bring that up. That if you're on a Medicare Advantage plan, this is the time of year where you're able to bring out and make changes. Obviously, from October 15th through December 7th. You can find all that over there on the Medicare and You book. You got one of those? That is chock full of good stuff, and we're going to bring this up. We're going to talk more about this in future broadcasts. I'm just getting everything up and going right now, but there on page 9 or so, You will see Medicare Part A and Part B. I do want to talk about this in a moment here, but the Medicare New Book is a good one that we're going to keep referring to as we go through the broadcast day after day, because of the fact that this is something that many people do not understand how their Medicare works, and they do not understand as well what a house of health care would look like in retirement to even cover the expenses that Medicare does not cover. So we will talk about how to build a strong house of health care that is affordable along the way. So having said that, let me just show with you a little bit of what I like to do here. This is my old whiteboard sessions here that we go. And if you're taking notes, I'm just going to give you a quick little parting thing to think about here. So if you got Medicare Part A, that's your hospitalization piece, right? And so if you spend one night in the hospital, you got your deductible that is going to have to be paid, right? Your deductible on original Medicare. And I just want to stop for just a moment, and I want to address, if you are on original Medicare, that means you have Medicare A, B, and maybe D. Listen up, original Medicare. And I know there's about 30% of you out there that are covering only original Medicare. You're not doing anything else. So let's get back to it. Part A, you have your deductible, and then everything is generally going to be paid 100% in the hospital, right? So give or take, there might be a little outstanding bills, but generally in the hospital. After that, you will have skilled care. So for instance, if you come out of the hospital and go directly into a skilled nursing facility, that is where you will have the first 20 days taken care of under Medicare, but then days 21 through 100, there will be copays, okay? Very, very important to get a hold of these things, because again, if you have straight Medicare and you have not done any kind of additional private planning along the way, I'm speaking to you today because it's a big deal. Now's the time to really do some planning around, first off, understanding what is your financial exposure. Part B is sitting here as well. Part B, that is your outpatient stuff, all right? Outpatient only. So this would be your testings, your therapies, your doctor visits. Doctor visits are sitting in here as well. It could be your outpatient surgeries, right? Outpatient surgeries are all under this Medicare Part B. Everybody has got to know this. So the problem is Medicare over here is only paying for 80%, which is going to leave you on the hook for 20% of this bill. This, folks, can get very expensive if you're on straight Medicare alone, okay? So be very clear that that's Medicare Part B. That's where a lot of financial exposure sits. Lastly, wanted to talk about this real quickly, is Part D. Part D as in dog. That's your prescription drug plan. If you don't have one right now, now's the time to be able to get on one up through December 7th. We are in the annual enrollment period, so make sure that you have that option. Remember, there are plans that may be $0, maybe it's $3 a month, maybe it's $5, I don't know. You have to go check them out. They can be very affordable, but it keeps the fee away, because Medicare will assess one along the way if you don't carry some kind of prescription plan Part D, all right? So there is some helpful thing. Just wanted to give a little quick shout out here as to Medicare Part A, Part B, and Part D. This is the very, very crux core elements that we're speaking about here is that stuff, okay? So I hope that helps on that. Let me also bring up something interesting that I have as well, and that is this Medicare Part A, B, and D actually fall into a building block house, all right? And over the course of time here, I'd like to kind of share what the rest of the blocks are along the way, but you can see there on the screen it is certainly we build this piece by piece along the way, and it's very important to understand how to build those blocks. And so we will do that as time goes on, build the blocks one by one. Okay. Now you're able to find out all the information over there on my website, myhouseofhealthcare.com, myhouseofhealthcare.com. You'll find out all the information sitting over there as well. And along the way, you will want to jump in, like I said, at 11 o'clock today. I'll turn on a Zoom room. It is private, and there will be a phone number that'll be up on the screen, and you can call me directly, or you can use your Zoom application and jump in. It is private. I only talk to one at a time, and so that's how that is going to work. Secondly, and by the way, before I move on here, let's just jump that in. Let's talk about this a second here. This is myhouseofhealthcare.com/office. That's how you get to this page, or you can go off of My House of Healthcare. That is 11 o'clock, and this is just basically an office hour allowing people to come in one by one. I've set you in a room, chat with a little bit. We may figure out what we want to go do from there, what questions you have, might be brief, and we can then discuss that a little bit more together on the Zoom. All right. Now, if you would like to set up a 30-minute appointment directly with myself or my partner, Leith, then you're able to go over to our website again over there at myhouseofhealthcare.com, and you'll see this screen up on the thing there where you can assign and book a time with myself or Leith. Our calendars are over there at myhouseofhealthcare.com. And that's kind of fun because of the fact that we're able to have set aside 30 minutes and go directly into what you're looking for on that. Whoopsie. Well, I think what's so important today is, after being in the business now for 20 years, I will say that the ability to get information prudent for retirees is going to become limited and limited and limited. And here's what I mean. Right now, you're getting blasted probably by the TV ads, okay? The TV ads, call 1-800, 1-800, 1-800 this, 1-800 that. Is that really the best thing for you? Is that really the best thing for you? And I can say, honestly, these guys are just running. They're just running the plans, and frankly, we're just picking pot shots. And then there's another thing, too, as we move forward, there is a thing where things are going to become more and more digitalized. And what that means is paper stuff, the normal stuff. I used to sit down with people face to face, belly to belly, and we were writing down paper apps. That's going away quickly. Well, but what if we don't have electronics? What if we don't have that capability? Well, that's where I'm able to help, because I've set myself up that I'm able to do things very efficiently electronically as well. And then also along the way, I'm a big believer of making sure that we just learn the basics of Medicare, right? Because if we learn the basics of Medicare, then we can actually sit here and build an effective house we build an effective house piece by piece, so that the healthcare expenses that happen in retirement, and believe me, they do happen in retirement. I want to make sure that those expenses that are, and I'm going to talk about this in a future episodes here coming up, how much dollars that will take from retirement savings. And there's research. I will bring out the research here, putting the slide set together. We'll talk more about that as to why it's so important to build this house, all right, to build this house of healthcare, and allow you to really protect your retirement savings. But the other thing I'm also really interested in too is making sure that you have the full ability to go where you want to go. Okay, there's nothing worse than saying, "Oh, I'm looking for a specialist, looking for a cardiologist, looking for this, looking for that." Not in the network, not in the Medicare Advantage plan that I'm on. That's a problem. That's a problem. You should be able to go to where you need to go. Okay. So that is a little bit about what we wanted to do here, is to be able to really be able to show off how to build this house of healthcare as we move forward here, because it's important. So again, make sure if you want to jump in on our Zoom call coming up here as we go forward here, that 11 o'clock, I'll be sitting there happy to chat. You can catch that. In fact, let me just drop that in the chat here. You'll see this over in the chat. So you can head on over to my house of healthcare.com/office. Okay. And that should be over there in the chat. Okay. And you'll see that there. You're able to jump on over there and see us at 11 o'clock, which would be almost 30 minutes from now. But if you want to have time on our calendars, well, then you can jump on over to My House of Healthcare, and I'll put that up in the chat here too. That's just a straight up My House of Healthcare. And you can go ahead and schedule appointments right from there for Leith and myself. Leith operates in the Western Washington State area. I operate in the Eastern Washington, Eastern Oregon, Idaho, Wyoming. We got more states that we're operating in, but happy to chat with anybody along the way. Okay, so with that, I hope that helps as we learn to build this house of healthcare, and we'll look forward to seeing you on at 11 o'clock in the office hour if you want. If not, we'll catch you tomorrow, and we'll start to build this up as we go along here. Lots of information I want to share, but it's important, absolutely important, that we get a handle on healthcare. Don't overstress it. Don't think about too much of it, because it is important that you have this fundamental healthcare plan built so that you're not surprised. There's nothing worse than having 80-something-year-olds go, oh my goodness, I'm having these problems. No, we should have anticipated it, okay? All right, with that, I'm going to sign off, Cianora, and we'll see you at 11 if you want to jump in. If not, I'll see you tomorrow, Wednesday. And by the way, Wednesdays, I'm talking long-term care. It is Long-Term Care Awareness Month, and I'm going to be talking long-term care, short-term care as well. So if you've got friends along the way that would like to hear about some of this stuff, make sure to like, subscribe, and share. Okay, go ahead and share us and get the word out, and we'll look forward to talking about long-term care tomorrow, Wednesdays. We're going to do those on Wednesdays. All right, we'll catch you soon.